Hello, this is Dr. Gay from First Link MRI, and this is a 20-year-old female who has complaints of forefoot pain, and we did see some findings in her forefoot that would explain that, but the technologist noticed there was something wrong here in the calcaneus, and so she did some additional images. So this is a side view, sagittal view. We see the Achilles tendon coming down to the back of the heel here, and this is the abnormality. It looks like a white, sharply defined region of abnormal signal here. You can see the marrow is dark, and this is very white. So this is a fluid pocket. Fluid is white on this sequence, or very what we call hyperintense on this sequence. This is another view looking at it from a different plane. Instead of a profile view like this, looking from the side, this is an axial view where we're going from the top, down, 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 and then we eventually get into this. We see it has very sharply defined margins. The marrow of the calcaneus adjacent to it is nice and uniform. There's no halo of fogginess or brightness around it, so it goes along with a benign lesion. We see it's not expansile. The cortex, which is the black rim, is nice and normal. It's not bowed out or expanded. And we also note that there is a little bit of low signal along the bottom of it here and along the medial border. So a little bit of fatty signal in here, maybe some marrow elements in here. So the two things this could be, number one, is what we call an intraosseous lipoma. You may say, wait a minute, this is not a lipoma. Lipoma should be fatty, just like the subcutaneous fat here, fat within, this is called Kager's fat pad back here, or fat in the heel pad here is dark. Well, normally lipomas would be dark, look just like this, or just like the marrow that has a lot of fat. But instead, this is white, like fluid. So this is either cystic degeneration or cystic necrosis of a lipoma. The fat has necrosed and been replaced by fluid, or this could just be a benign bone cyst. And either one could look just like this. This patient does have a little bit of darkness along the bottom, which means there are some marrow elements within. So I think this is probably an intraosseous lipoma that has undergone cystic necrosis or degeneration, but a bone cyst could look identical, and there's not a good way to tell them apart except for this dirtiness along the medial cyst. Again, makes me think this is probably used to be all fatty, and now it's been replaced by fluid, and there's some remaining fatty elements. But this is a case of an intraosseous lipoma that looks like a cyst, or possibly a cyst that just has some complexity. And that's it, a benign lesion that you don't have to touch. These can sometimes cause pain, and sometimes they can cause the bone to be weak and they can fracture. But most often, or in my experience, we see them incidentally. They have pain somewhere else, and you just happen to see them here, or on x-ray you find them. And that's it. Thank you so much.